Good afternoon, everyone. It is March 28th, and so it's been half a week, and since that's the units on which I like to put these things out, because that's the only unit by which you can really see what's going on with the data. You can't really track the data day by day. You have to do it week by week, or half a week by half a week if you're in a huge hurry. So with that in mind, it's been half a week. Now it's March 28th, and we have some new data. In fact, I have an exciting new graph. Of course, I'm the type of person who gets excited by a new graph. So here's a new graph that I think is really going to be helpful for us looking and saying, where are we at in beating this thing? And how do the different states compare? It's looking like each different state is going to have its own set of challenges, and yet the solutions are going to involve a similar set of solutions from all of us across the nation. What does it look like in different states? And I want to show you a graph that compares that. So my real question is, are we halfway there yet? I was possibly a little optimistic in the last video where I said there might be a week or two of this left for the Seattle-King area. That was probably a slightly over-optimistic way of looking at it now that I look at more of the data. That was assuming that we can act like South Korea. And we've always been like South Korea, but a little bit worse, okay? So that implies that the South Korea estimate would be the best case scenario. There's some more data that's come in, and that suggests to me that we aren't exactly on the South Korea line, but we're still looking okay. The important thing is down at the bottom. You look at the mortality, and it's still linear is the important thing. We don't have a surge of new deaths coming through the system. We have it doubling every week, which is bad, and we need to get it down. We can't keep that up forever, but we definitely are going slower than many of the other places that are doubling every half a week. So it's much better to be in our position than it is to be in the position where we would be if we didn't do any of this social distancing stuff. So when we look down the three categories of data, there are a lot of new cases in King and Snohomish County so far. I think that this is from some signs that we are expanding testing, and we are actually testing more people. We're testing everybody who's an inpatient in certain cases and things like that. The interesting thing is that the percentage of the testing is holding true at about 10% for all the cases. Hospitalizations, again, we only have a window in Snohomish, and those have appeared to plateau. I said, I hope these don't go up anymore. I hope they go down. It looks like they've gone down and then they've gone back up again, but at least they're not up above where they were. So let's take a look at the hospitalizations first. Here's the Snohomish County hospitalizations for the past week. And you see I've drawn a line at 65 hospitalized residents of Snohomish County, which is what the website reports. And you see that we are hovering right around that line. We're bouncing up and down. We were down to 48 one day last week, but then we hopped right back up to 71. So we're around 60 to 70 patients with COVID-19 in Snohomish County hospitals. And again, this looks like it's stretching our capacity. According to the Everett Herald article that came out, it looks like we are within capacity. We're bending but not breaking, you know. So we have that. It's that good news. Is the glass half full or half empty? Well, at least there does not appear to be a surge coming through right now. And let's just keep hoping and praying for this line to go down. The really interesting thing that I found, and this was in the Seattle Times just yesterday, I think, they had this article. And the headline says that there's a projection of what the UW is doing based on the data and projecting what the data is going to look like for the whole state. Again, remember when comparing this, I've been projecting for King and Snohomish counties. This is a projection for the whole state. But nonetheless, those are definitely similar things, and we can talk about one while we're talking about the other. The projection is 1,400 deaths, which is bad. It's unlike anything that we've seen in a long time for this kind of infection. But it's also within the capacity of the healthcare system to absorb if steps are taken now to prepare for a surge in ICU beds. In fact, that's exactly what this study predicts. So the number gets in the headline, the total number of projected to die from COVID-19 in this state. But I found that the good news was a little bit farther down in the article, which was that it looks like we are going to have enough beds. It looks like we are going to be stretched on ICU beds. We need to come up with a few more, but we can probably do it. And I don't really know where we are on ventilators, but at least we know the number that we'll probably need, and so we can start planning for that right now. Again, it looks like a bend but don't break situation for Washington State. The projection that we have here is we have the curve of the epidemic, and the real question is, where's the peak of this? When you do the model, you get this really nice smooth curve, right? But when you collect the data is going up and down. Each one of these data points is a very complex situation. It's a person who's died. People need to be notified. The system needs to make sure that it's gotten things right, and that stuff has to happen before it goes into the data set. For all those reasons, the data can be very much up and down day to day. But when you look at it week to week, you begin to see that there's trends. And so what they have is they have the trend of the actual data. You see how jagged it is over here. But then it smooths out to the projected idea. And this is like the 50% average projection. It could be a lot up from this. It could be a lot down. The good news is this is within the bounds of what the system can handle. The exact numbers are on the website. I'm going to return to that because the one thing about this, you notice a lot of exponential curves, a lot of bell curves, a lot of things that curve up and curve down. And the problem with curves is that one curve looks like another to us. It's easy for me to tell if something's a flat line. But if something's a curve, how much is it curving? And very small differences in how much it's curving will result in very big differences when you go a little bit farther down the curve. So how do we straighten out these curves right? There's pluses and minuses to the ways of doing each of these graphs. Logarithmic functions are a classic way to stretch out, to describe curved functions and things like that. And so I found this. This was posted by one of my friends who's a physics professor now down in California. And he posted this as a really good example of physics applied to medicine. And so this is on the Minute Physics page. If you search for this exact video, you can hear about how this graph actually works. But I want to show you how it moves. Atish Bhatta is the person whose name is on this graph, the author of this graph. And it's a graph of new cases on the y-axis versus total cases on the x-axis. I keep saying that wrong, but who has time to edit a video these days? If you look at the graph, you can go to this, and I want to show you what it actually looks like. You probably can't see this too well on your screen, but you can go to this site, and I will show you what happens. What you have is you have the infection of cases represented as a line that always is going up. This is by number of cases, not by date. And so you see right here we have the Chinese line that is going up, China's line of the infections. They were the first ones to do. On February 8th, they reported this many total confirmed cases. And the y-axis is just how many cases were reported in the past week. It seems very simple, but it really gets at a truth about it. Watch what happens to the China line. So it sort of digs down there a little bit. So you see how it goes around a little bit. Because this is on a logarithmic scale, that's actually, if you were looking at the data on a linear scale, that could distract you from what's going on. But on the logarithmic scale, it shows that the data is pretty much following, still going down the same line, going up. Then China brings it under control, and their line drops. At the same time, we see cases appear in Italy and South Korea and Iran. Watch the South Korean line, which is going to be in the middle here. And there the South Korean line starts to drop off. Not quite as sharply as China's, but this shows you South Korea getting it under control. So basically when this line is shooting up like this, the epidemic is not on the downswing yet. It's still on the upswing. When it starts to be under control, when the cases actually start to go down as far as a new case, they start to fall off the exponential growth curve, you literally start to see the line drop. And so you see that the South Korea line drops, and if you look at the Italy line, it's still going up, and here comes the U.S. number of cases. This is not normalized for per capita or anything like that, but as far as which country has the most cases right now, that is our distinction as a country. And so you see that not many countries have dropped off. Maybe Japan's dropped off, South Korea, and China. Other countries are sort of bending down a little bit, and you can see even Italy is bending down a little bit when you look at the very far edge of this. Now, I want you to go to this site and look at this page on your own to look at the data. But But it gave me an idea. Why can't I do a version of that graph, not for countries, but for states? And so here it is. This is my version of the graph. This is not animated, but instead it shows each day as a data point, and you can see by the connection of the lines where things are going. I have 6 states that I'm comparing here that are all hot spots in their own way. And this is the same kind of graph. Notice that the perfectly diagonal line is an out-of-control sort of perfect exponential in a certain way. When you start pulling away from that exponential, that means you've slowed the growth. You haven't even turned around the growth. It's still growing, right? But you've slowed the growth of the epidemic. And if you separate out by state, you see that New York and New Jersey are the 2 states with the most total confirmed cases, and they are shooting up on a diagonal that is very close to that perfect exponential growth diagonal. But I want you to also notice something else. Notice that little divot for both New York and New Jersey at about the same time, that you see that the number of cases dropped off that line. Still growing, but growing by less. I believe this is social distancing kicking in. And on this graph, it doesn't look like it's doing much. But remember, logarithmic graphs, the way that they curve, it actually is doing a lot. And especially in terms of time. It's buying time for the hospitals to try to respond, ramp up their ICU beds, get their critical care units underway. Even with this social distancing time, you see that it hasn't done everything. And New York is in a really bad situation right now with this. We need to find a way as a country to help them in any way possible and to slow it in any way possible. Social distancing has done this much, and that's about what we can expect it to do. Now, New York and New Jersey sort of swamp out this graph. So now I want to zoom in on the other 4 states. Florida in orange, Louisiana in purple, California in blue, and Washington in green. And notice that for all of these, the Washington graph is the lowest. Again, it looks like social distancing is working in Washington. And in fact, for a couple days last week, it looked like social distancing was even going to possibly bring us down off the curve. And then all of a sudden the curve jumped back up, but it jumped back up to the line where it was before. Look at that green line. It's back where it started, in a sense. And so I think that this is, it's actually something that I saw in the China line from the previous graph that was done by nation. And I think that it's a case where you go from one testing pattern to another testing pattern. You start to test a lot more people. Because again, realize this is confirmed cases. This is not mortality. This is not hospitalizations. This is just what you're detecting. And so we're detecting a lot more cases, and we're still seeing those cases grow. But I believe, remember, the hospitalizations have been flat for the past week or more in Snohomish. And so again, I believe that we are catching more of the mild cases now. And I'm really hoping that this will follow the pattern of the China line, which means a couple more days of this, and we might see it start to curve off this line, and we might even start to see it drop for good. That's hopeful. If we flatten the curve, we've slowed things down, which is good because we bought time, but it's on this graph, it would mean that we have to wait longer for it to drop off. That's okay because we're still below the diagonal line more, and that's what's really important here so that we can stay within critical care capacity. Just a quick look at the other states. California appears to be on another line where they have dropped about as much as we have, but they have also, it looks like they even avoided the worst of it, but then cases have started to climb up again. And California, by the way, has a ton of pending tests right now, so I really don't know what a case-based measure like this graph even has to say for predicting the future. We'll have to check in with California in another couple weeks. Notice that Florida and Louisiana are both higher curves, but they're below the rate of New York and New Jersey. So it's kind of like good news, bad news once again. They haven't dropped it as much as Washington has, but it is not looking like the explosive Italy-type growth that New York has had. So, you know, that's what the data is. It's good news and bad news. And I'm hoping that we can keep an eye on these things. The other piece of good news is not that many other states even have enough cases for me to show on a graph like this. I'm especially worried about Louisiana. I think that the Mardi Gras parade and Ash Wednesday church services working together possibly cause an assembly of people that would spread the disease, and that's one of the reasons why Louisiana might have more of an outbreak than other neighboring states. So let's keep an eye on these things. It looks like Washington is doing okay so far, but we have to keep it up. Notice that this line is not dropping yet. I'm hoping and praying that it will drop very soon. If you ask me how soon it will drop, I hope it will start dropping within a week or two, and then it'll take another week or two before we're even starting to be out of the woods as far as being on the other side of that bell curve. So notice that this right here is about where we started social distancing in Washington. You see that big drop in the green line. And right here is the line where it looks like we were dropping, and then I think we changed who we were testing. We started testing more people. We started detecting more cases. Hopefully that we'll get that out of our system, and this line will start to drop soon. The last thing I want to do is I want to go back to the website, covid19.healthdata.org. That's the site of the institute that made that graph that I showed you from the newspaper. And I went to plot the data. That data only went through March 23rd. So I went to plot the data of the deaths reported in Washington on that roughly. I made these points small because, these were done by hand. This is literally a handcrafted graph. But I want to be able to look at this and say, okay, how close are we to the model? And again, the data is really up and down, right? But you see that 4 out of 5 of the days have been around the line that they were saying. It looks like this model has been accurate for half a week. And again, you look at this last line. Just today, the number of deaths that were reported in Washington are way up. That's a little scary, but it's also probably within the up and down nature of data. Remember my rule, don't look at just one day. You have to look at the whole week. So as far as the whole week goes, it looks like we are close to the line of predictions. We'll keep an eye on this. If these predictions are right, our healthcare system, we need to take care of and support all of our healthcare workers as much as possible. It looks like they have a very heavy burden ahead of them. But it looks like it's a burden that in this state we can carry. New York, the projections look a lot scarier. And so we need to do everything we can to try to carry their burdens. And again, I believe in carrying the burdens as far as providing protective equipment, as far as helping them rest and have shifts that keep them from getting sick and keep them being able to physically do their jobs. And also, I believe that prayer is a way of carrying burdens. Literally, you are carrying some of their spiritual burden when you pray for them. And so I ask that you would join. I know that, one of the reasons why Lent is such a long season, when you're about halfway through Lent, you suddenly start to realize, oh, I'm not doing those things that I promised I would do anymore. Like I've noticed for myself, I haven't been praying as much over the past couple of days. Well, as part of the spiritual discipline, it's normal and natural for that to happen, but that doesn't mean that it's what has to happen going forward. Okay, so basically, those of us who are in the middle of a Lenten season, I want to be thinking about for myself, how am I falling away from my projected carrying burdens that I need to do for others during this Lenten season. And so if that involves prayer for you, I invite you to use that as a call to prayer. If that involves donating some extra PPE that you have around, I invite you to do that. So listen for what your role in carrying these burdens is going to be. So if we are halfway there, then about 3 weeks ago was when my school closed, and I said that I thought this might last about 40 days. Again, social distancing might have actually drawn that out, but brought the curve down so that it fits into hospital capacity. So there's 3 to 4 more weeks until we return to where we were when I started these. I'm going to make that sort of vague prediction. We can start thinking about what restrictions we relax and how. I know people who have caught this, tested positive, and have gotten over it. People that I love have been in that situation. They should be immune now. And now we can start asking the question of, okay, these people that should be immune, what can they do? Where don't they have to socially distance anymore? And how can they carry others' burdens? The one last thing I want to leave you with, I'm a structural immunologist. I study the immune system. And remember, there are positive exponentials in the immune system. Everybody's immune system is making defenses or trying to make defenses against this stuff. It's a nasty bug, and it's hard to make defenses against, but we are trying nonetheless. So your molecules are fighting off this virus, and a lot of immune systems must have fought it off without telling us. We know there are people that test positive and then never develop symptoms. They must have fought it off somehow. In fact, even in the Life Care Center, where they tested all the elderly patients that were there, 27 tested positive. 3 of those never developed symptoms. That means 10% of the positive tests in that age bracket, which is the one we're most frightened for, never developed symptoms at all. Somehow they fought it off, and they did not exhibit the symptoms of COVID-19. So how many people are like that out there right now? I've been trying to get a handle on this. Is 1% of the population immune now, or is 20%? I'm really not sure. I'm hoping that it's closer to 20%. You may have seen a study that suggests that that up to 50% of the UK might have caught it. That study was badly reported. That 50% was an assumption, but the ray of hope it gives me is that the 50% was an assumption that they thought was worth plugging into their model in the first place. I really don't think, hoping beyond hope, that it's that high, but maybe it's around 10-20%. The other side of things, you need the population to be at least 50-60% immune before you can really say, okay, everyone can go out and about their business now. And 20% is nowhere near 50%. I don't know where these numbers lie right now. All I know is there is some good news out there yet to be found. The way we'll find out about this, there's a new kind of test. It's called a serological test, or it might be called an antibody test colloquially. And because antibodies are some of my favorite molecules, I'm really excited about the possibility of getting that. Viral tests can only tell you if the virus is in your system right now. They're a present tense test. Antibody tests can tell you if you ever had the virus. And I'm hoping that we will find a significant portion of the population has already had the virus and has antibodies to it. But we'll have to wait and see. We can't count on something being there until we actually see it. I just know that it's a possibility. So with that in mind, keep on carrying each other's burdens, and hopefully in about half a week I'll be back, I hope, with some more news. Good news and bad news, I'm sure it'll be a mixture, but let's pray that it's more good news than bad news. Until then, take care.